You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, restoring mouths and rebuilding smiles. With us, we have two board-certified prosthodontists, Dr. Seaman and Dr. Wiley. So pleasure to have you on the show. We've had you on before, and we've talked off camera. You say that we have a very unique practice. What makes you unique?
Well, a prosthodontic specialty practice, we don't get the patients that are just routine. General practitioner practice, most of the time, they're hygiene, maintenance, and they're more tooth-oriented. We have to look and rebuild the whole mouth and the whole image for the patient.
I've been told that a prosthodontist also is the true cosmetic dentist.
Well, in our
is that fair to say?
Yeah.
It's a big part of what we do is also restoring the smile.
Because you're doing dental implants. I mean,
right.
So who is the typical patient, by the way, that you see? Is there a typical patient?
A typical patient is one that comes in and they have multiple different needs in their mouth, and they're watching a decline of their dental quality and their comfort in their mouth. And so also with their smile, they're noticing they're smiling less and hiding their teeth more.
They could be missing teeth. The teeth could be eroding away or wearing away. You know, our population they're keeping their teeth longer, and that means teeth are being subjected to more wear and erosion, and now they've lost their smile. They've lost their function. The bite's collapsing.
Okay. And many of them think that nothing can be done.
Do they really say that to you?
They do.
Oh, absolutely. I mean, some are in tears. We literally have a Kleenex box.
Is that right?
As they start talking, they'll cry.
About their teeth?
Yeah. And one of the things I wanted to bring up about what makes our practice unique is as Frank said, they come in with multiple needs. That means they may be missing teeth, they may be missing bone, missing tissue, their smile, facial pain. And what we have to do is we have to be the quarterback. Okay. We have to organize this treatment plan that has been mutually accepted and organized how the surgeons are going to help us. They may need root canals. Frank's going to show a case on where we actually had to use orthodontics on an adult to get teeth back in the right place.
Okay, let's start with dental implants, just a single tooth.
Sure.
And what are the age ranges, by the way? How young could you be?
Well, actually, I'll show you that case right here, Randy. He's only 15 and a half years old. Normally, and this is a male, we used to do this when they were about 18. And female patients, we would do at 16. But we found with the downward and forward growth, delayed growth that a lot of these younger patients have, the bone and tissues come down and the teeth come down, but the implant doesn't. So we have to delay that. And a lot of these patients just will not put up with an orthodontic flipper type retainer. We now have the ability with one of our ceramic products to literally, without having to cut on the adjacent teeth, we can make an all ceramic bonded restoration, which actually is a permanent restoration and can last them 3, 4, 5, 6 years until they can get an implant done. A more common type patient is, this may not look very complicated to the average person, missing one tooth, but look at how much bone height and width this patient has lost. Just trying to put a tooth in there would look fake.
So when a tooth is missing,
yes,
the bone goes away.
Yeah, you can lose up to 50% of the width from the lip to the palate with just the extraction of a tooth, unless we work with a surgeon that can help restore that or rebuild it. Okay. In this case right here, people like to have something right away as often as possible. The surgeon, we made our radiographs, we could put an implant in here. So not only did we put the implant in, the surgeon wanted me to develop a form of root and tooth as it comes out of the gum right at the day of the implant's placed. So I made a provisional restoration, and it has to stay where they can't bite on it, but it gives them some looks. And look what we were able to do in just several months. We were able to give this patient back the volume and the aesthetic scalloping for this. And what I always tell the patients is that the implant is the root, and we're going to make you a new tooth which screws onto the implant right here. And then we also did a veneer on the other tooth. And look, you cannot tell which one of those. If you didn't see this picture, and this is a 5-year follow-up, it's just remarkable. But this is not a one-day procedure. This took us probably 5, 6 months to develop, to put the implant in. The surgeon, and we use a periodontal surgeon more often than not, because they really work with the tissues well.
I'd like to point out one thing on that last picture there, Mike, is on the picture with the teeth. It's our job as restorative dentists to go ahead and make that artificial tooth substance, porcelain, look like it's emerging out of the natural bone, like it's a natural.
So you can have a dental implant even in the front and make it look natural.
Right.
Absolutely.
Right.
Okay. Now, when I see advertising and things like that, where you go in, you get your teeth right then and there, in one day, or in 1 hour, or at lunchtime, or whatever. You smile. We've talked a little bit off. You said maybe a little bit of an exaggeration.
Yes.
It's being oversold. What do you want? What do you need the public, or what should the public know about things like that?
Well, really, that's just a temporary restoration. It needs to be replaced at some point in time. Depends on what the situation is. One implant, one tooth, or all of the arch, the full arch, and it can last up to 6 to 12 months. And so at that point, something more long-term needs to be discussed and finalized.
Right. Frank's got a couple really, really good cases that's going to show in just a couple minutes on that.
So whether it's one tooth, then what about multiple teeth?
A much more common patient. People that are missing 1, 2, 3, or 4, 5, 6 teeth up front. And we really want to be able to give them options, because good old conventional prosthetic dentistry still holds. Here's a lady who over years has lost a tremendous amount of bone and tissue, and if we just put single crowns on implants, her lip would be sunken in. So with a removable prosthesis, a partial denture, one that is removable, snaps in, we placed 2 implants. But look at how much volume we had to regenerate for this patient, so that when she smiled, she has a natural looking smile.
It is very nice.
And even those
they don't look like dentures.
No. And actually, the old saying is, when I talk to patients, these aren't your grandma and grandpa's dentures that we make these days. So this is a more conventional.
What do you call it? Do you call it a cosmetic denture?
Oh, it's just a removable partial denture.
It's a custom denture. We are replacing both the teeth and also the tissue, the gum tissue, for facial support. We need to arrange the teeth also so they look most natural and most aesthetic.
And this doesn't involve just sending something to the lab and get something back. We have aesthetic try-ins. They get to see this in wax, or we can customize the teeth.
It's so exciting.
And we have a full open catalog where they can select from probably 30, 40 different shapes and contours.
Okay.
Another example is, this is a more conventional type, what used to be done before we had implants. The patient is missing the 2 front teeth, but has 2 really strong adjacent teeth. Okay. She did not want implants, but she did allow us, remember how in that first case I showed how the bone had sunken in and everything else? Okay. This patient allowed us, from the time the teeth were taken out, for the surgeon to rebuild the socket, hold it, and then I was able to make a temporary restoration, and look at the scalloping on there. It looks like you can just see where teeth came out of there. Okay. And by doing that...
That was all planned out.
Oh, absolutely. And this is all part of our... And I show this is sort of the bottom side to show you one of the different types of restorations that people are asking for. A lot of people don't want metal in their mouth.
So there's no metal on that?
There's no metal. Right. This is zirconium framework. And our ceramist customizes and veneers it with the real shiny enamel porcelains. And look, now we have a bridge that's coming out of the tissue, not laying on top of it.
Very nice.
Right.
Yeah.
Remarkable.
Now, here's a situation. Danny, she's a med student on the East Coast, sees us during the summers. She had a athletic accident.
Is it painful, by the way? I mean, do the patients complain about pain? It seems awfully painful.
Pain is not a comment that all of our patients ever make.
So in the front, so these are implants in the front.
Right.
And they're matched.
I mean, she can eat apples. And the other thing that we haven't mentioned is that not only is our specialty involved with replacing what's missing, tooth structure, we want to preserve what remains. And implants help stimulate the bone from inside and keep that bone tall, volume, and it's helping her for the rest of her life.
You love this stuff. You guys like this stuff.
I'm telling you, what it does. I remember in dental school we used to joke, boy, I'd love to screw this denture in. I just can't keep it in place. Well, we can do that now.